The bright lights of St. Mary's emergency ward cast everything in that distinct hue of clinical white which seemed to drain colour from the world. Emily Carter sat in the hard plastic chair, her hands clasped tightly in her lap, resisting the urge to simply walk away and pretend nothing was wrong. At 29, Emily had always been the quiet one, the librarian who preferred books to people, finding comfort in the orderly realm of catalogued stories and soft conversations. But today, her carefully structured world had been shaken by something embarrassing and painful that she couldn't ignore any longer. She'd waited 3 days, hoping the issue would resolve itself. When it only worsened, her best friend Clara had nearly dragged her to the emergency ward, threatening to call an ambulance if Emily didn't go willingly. Emily Carter, a nurse with kind eyes and silver-flecked hair, called from the doorway. Emily followed her down the hall, her cheeks already warm with expected shame. How do you share something so private with strangers? How do you hold on to dignity when your body betrays you in the most unsettling ways? Room 7, the nurse said softly. Dr. Michael will see you soon. Try to relax, dear. We've seen everything here and there's nothing to feel ashamed about. Emily nodded, though her stomach kept twisting with anxiety. She'd changed into the medical gown and was perched on the examination table, staring at her hands, when a gentle knock sounded at the door. Ms. Carter, I'm Dr. Michael. Emily glanced up to see a man in his early 30s with warm brown eyes and a surprisingly kind smile. There was something instantly calming about his presence, the way he moved with quiet confidence, the respectful space he kept, the sincere care in his voice. I hear you're dealing with some discomfort, he said, settling into the chair beside the table rather than looming over her. Can you tell me what's been going on? Something about his manner, the way he held eye contact without being intrusive, the steady patience in his tone, made Emily feel safe enough to describe her symptoms. Dr. Michael listened without judgment, asking gentle questions and nodding with empathy. What you're going through is more common than you might think, he said reassuringly. It's a bacterial condition that can affect anyone, and it's fully treatable. You didn't cause this, and there's no reason to feel embarrassed. The examination was performed with such professionalism and compassion that Emily found herself easing up for the first time in days. Dr. Michael explained each step, why it was needed, and what the treatment would entail. We'll begin with antibiotics, he said, washing his hands at the small sink. You should feel relief within 48 hours and be fully healed within a week. Follow up with your primary doctor in 5 days, but if you have worries before then, don't hesitate to return. As he wrote the prescription, Emily caught herself studying his face. There was a unique quality to him, a depth of care that went beyond mere duty. When he handed her the prescription, their fingers grazed briefly, and she felt an unexpected spark of something she hadn't felt in years. Dr. Michael, she said as he turned to leave. Thank you for being so kind. I was so scared to come here. He turned back with that same warm smile. That's why we're here, Emily. And please call me Michael. Take care of yourself, and know there's nothing wrong with seeking help when you need it. A week later, Emily returned for her follow-up visit. The condition had cleared completely, just as Dr. Michael had promised, but she found herself hoping to see him again. Instead, she met Dr. Harris, an efficient woman in her 50s who confirmed her recovery and cleared her for normal activity. Dr. Michael asked me to tell you. He's glad you're feeling better, Dr. Harris mentioned as she updated Emily's chart. He doesn't usually check on patients personally, but he seemed especially concerned about your case. Emily left the hospital with a mix of relief and quiet disappointment. She was healthy again, but the brief connection she'd felt with the kind doctor seemed just that, brief. 3 months passed. Emily had returned to her calm routine at the city library, sorting new books and guiding patrons to their next great read. She thought of Dr. Michael now and then, often when passing the hospital. but she'd tucked the memory away as a small moment of human kindness that made tough times bearable. Then one Saturday afternoon, while restocking the medical reference section, she heard a familiar voice behind her. "Excuse me, could you help me find resources on community health programs?" Emily turned to see Michael, standing in the aisle, dressed in casual jeans and a sweater instead of his white coat, looking both more approachable and strikingly handsome. "Dr. Michael," she said, surprised by the warmth she felt seeing him. "Michael, please." "And you're Emily, right? From the ER a few months ago?" She nodded, touched that he recalled her name. "Yes, how can I assist you with community health?" As she guided him to the relevant section, Michael shared that he was researching mobile health clinics for underserved communities. "I've been thinking about launching a program that delivers basic medical care to those who can't easily reach hospitals, rural areas, elderly folks, that sort of thing." Emily found herself genuinely engaged in his project. They spent the next hour discussing resources, and she helped him find several valuable databases and papers. Their conversation flowed effortlessly, shifting from professional topics to personal interests, books they read, places they'd visited, dreams they held for the future. "I should probably let you get back to work," Michael said eventually, though he seemed hesitant to leave. "Actually," Emily said, surprising herself with her boldness, "my shift ends in 20 minutes. If you'd like to continue this over coffee, there's a cozy cafe nearby." Michael's smile was answer enough. Over coffee, Emily learned that Michael came from a family of physicians but chose emergency medicine because he wanted to support people in their most fragile moments. He'd grown up in a small town where the nearest hospital was an hour away, and he'd seen how lack of healthcare access could devastate families. "What about you?" he asked. "What drew you to library work?" Emily opened up in ways she rarely did, sharing her love for books, her belief that libraries were one of society's last truly open spaces, and her quiet joy in helping people find exactly what they needed, even when they weren't sure what that was. "You know," Michael said thoughtfully, "what you do and what I do aren't so different. We both help people who come to us in need, often feeling uncertain or exposed." Their coffee date stretched into dinner, and dinner led to a long stroll through the city park. By the time Michael walked Emily to her car, they'd discovered a dozen shared passions and an easy connection that surprised them both. "I'd like to see you again," Michael said, as she unlocked her car door. "Not as a patient, obviously, but as someone I'd really like to know better." 6 months later, Emily stood in the same urgent care where they'd first met, but this time she wasn't a patient. She was there for the dedication ceremony of the new mobile health clinic, a project that had grown from Michael's initial research into a fully funded program serving 3 counties. She watched proudly as Michael spoke to the gathered crowd about the importance of accessible healthcare and the strength of community support. He'd worked tirelessly to make the program a reality, and Emily had been there for every late-night planning session, every grant application, every moment of doubt and triumph. As the ceremony ended and people began to mingle, Michael found her in the crowd. "So," he said, taking her hand, "how does it feel to be dating a guy who's technically a millionaire now?" Emily laughed. The grant, money and donations had indeed made Michael wealthy on paper, though every penny was dedicated to the health clinic project. "I think I fell for the doctor, not the bank account." "Good thing," Michael replied, "because I fell for the librarian who wasn't afraid to help a stranger find what he was looking for." Later that evening, as they sat in Emily's small apartment, surrounded by books and medical journals, Michael shared something deeply personal. "That day you came to the ER," he said, "you were so scared, but you were also so brave. You faced something that frightened you because you knew you needed help, that kind of courage. It changed how I see my patients, how I see everyone, really." Emily curled up beside him on the couch, reflecting on the unexpected journey that had brought them together. "You know what I learned? Sometimes the things that embarrass us most, the moments when we feel most vulnerable, those are the moments that lead us to the people who matter most." Michael kissed the top of her head. "Remind me to Thank that bacterial condition someday. Emily laughed, but she understood what he meant. Sometimes life's most uncomfortable moments are actually gifts in disguise, chances to experience the kindness of strangers, opportunities to be truly seen and cared for, doorways to connections we never could have imagined. In the stillness of that evening, wrapped in the comfortable silence of two people who had found their way to each other through the most unlikely odds of circumstances, Emily reflected on the surprising wisdom of vulnerability. Sometimes, she thought, the very things that make us feel most alone are the things that ultimately bring us home. If you enjoyed the story, don't forget to like, share, and subscribe to the channel. Hit the bell icon so you never miss an update.